So the last part of this lecture is looking at hypothesis. And a hypothesis is basically an educated guess. So if I go back to this example here, which we looked at before, if you have a client who has tetracycline staining, do you think that zoom whitening will help? And let's say my hypothesis is that yes, zoom whitening will help. Let's just hypothetically say that I predict that zoom whitening will help with the tetracycline staining. That's my hypothesis. That's my educated guess. So hypothesis is what you think would be the answer. The answer that you are predicting is your hypothesis. So your prediction or your opinion. Now we have two types of hypothesis in research. We have the null hypothesis and we have an alternative hypothesis. The null hypothesis is basically a statement where you say that there is no relationship. So here, let's look at this example. Cats show no preference for food based on shape. Notice the word no is in that statement. Plant growth is not affected by light color. Notice the word not. Age has no effect on musical ability. Notice the word no. The way I remember it is no, so the N for null stands for no or not. So when you have the word no or not in the statement, it's likely a null hypothesis. If you compare that to an alternative hypothesis, this is your research hypothesis. This is your actual hypothesis. And the way it's denoted is H1 or HA, and the A stands for alternative. When you look at the null hypothesis, it's actually H, and this 0 is actually pronounced not, N-A-U-G-H-T, so it's denoted by H for hypothesis and the O or the not or null. So alternative hypothesis is your actual hypothesis, your actual research hypothesis. So here we have an example where the alternative hypothesis is that using fertilizer will increase plant growth. And the null hypothesis is that the application of fertilizer will not increase plant growth. Notice the word not. So the N in the null for no or not in the statement. So let's look at this example. For a client with moderate chronic periodontitis, will debridement with an ultrasonic instrument compared to hand debridement better remove tenacious calculus? So what's our problem? What's our P? Our P is someone who has periodontitis. What's our I? What's our intervention? Our intervention is debriding with ultrasonic, so using Cavitron, for example. What's our C? What are we comparing it to? Comparing it to hand debridement. And what's our O? What's our outcome? Outcome is the removal of the tenacious, of the very hard and sticky calculus. So if you have this as your PICO question, you would have two hypotheses. You would have a null hypothesis and an alternative hypothesis. And this is your null hypothesis. Ultrasonic instrumentation is not, remember the word no or not should be in the statement. So ultrasonic instrumentation is not significantly more effective than hand scaling during periodontal debridement. So here, the null basically means there's no relationship between the two. Whereas your research or your actual alternative hypothesis is that ultrasonic instrumentation is significantly more effective than hand scaling during periodontal debridement. So this is what you generally would assume. This is your opinion. Your opinion is that ultrasonic instrumentation is better than hand instrumentation. The reason why we need to know hypothesis, so the reason why it's important to know what the null hypothesis is because towards the end of this semester, I'm going to be talking about the null hypothesis. I'm going to be talking about something called p-value, and knowing a little bit of, or knowing the understanding of what a null hypothesis is will help you understand how to calculate or how to really utilize the p-value when you're coming up with a conclusion for your client. So there is a specific criteria that we make to come up with a conclusion or to come up with a statistical decision, and knowing what a null hypothesis is will help you come up with that statistical decision, and we'll learn more about that towards the end of the semester. For now, what I want you to do is pause this video and watch this clip here. It's a 4-minute clip about, it's a clip from Big Bang Theory where Sheldon Cooper got drunk. And when you're watching this video, I want you to think about what the problem was, what the intervention was, what could we have compared the intervention to, and then what was the outcome. Okay, so watch that video and we'll return back here and we'll go over the answers. So if you've watched that video, I'm hoping that you noticed that the problem was that Sheldon got very nervous when he was going up to speak. So problem is nervousness in public speaking events. Intervention. What was the intervention given to him? Alcohol. Penny gave him alcohol in the hope to calm him down. C. What can we compare it to? We can compare it to him not having any alcohol. Or you could say that, maybe if he practiced deep breathing exercises or other psychotherapy methods, it might help him calm down. So any of these would be acceptable. And then, what are we hoping for? We're hoping to decrease his nervousness. So if you incorporate all that into a PICO question, it would look something like this. So for a patient who is nervous in public speaking events, will the use of alcohol compared to no alcohol, so here we're comparing it to no alcohol, decrease his nervousness and symptoms of dizziness and faint? Because Sheldon earlier in the video said that he felt dizzy and he felt as if he would faint. Or you could even have something like this. So it's all the same except here where it says compared to deep breathing exercises. Here I said compared to no alcohol. You could also say compared to deep breathing exercises. You could say compared to other psychotherapy methods, right, that you may think of. And you would hope that the intervention or the comparison would help decrease his nervousness. That's how you come up with a PICO statement. And then we have to figure out what the null and alternative hypothesis is. So remember, null means that it has to have the word no or not in the statement. So in this case, the use of alcohol will not decrease nervousness in public speaking events. And this is your alternative hypothesis, where you think that the use of alcohol, maybe in moderation, will decrease nervousness in public speaking events. So in the this week's discussion, I want you to watch any of these 3 videos. So there's one video over here. This is a video from Friends talking about Chandler's allergy, or his so-called allergy to dogs, rather. Here's another clip about Amy's smoking monkey from Big Bang Theory. And then here's another clip about Ross whitening his teeth, and this is from Friends. So feel free to watch any one of these. And what you're asked to do is do exactly the same thing here. You're asked to come up with what the PICO is, write the PICO question, and figure out what the null and alternative hypothesis is. And you can do that by watching any of these 3 videos and coming up with your answer. And it's okay if your answer is different from a classmate's, because there's many ways that we could come up with a PICO question. So really there's no right or wrong. So just feel free to come watch these videos and come up with a PICO question and a null and alternative hypothesis. You do not have to do all 3. You just have to choose one and write about that. Thank you so much. I look forward to reading your response.